Hi, I'm Jamie Phillips and we are Group 4. My team members include Robert Fuentes, Zoey, Phan, and Jeannette Mojica. Our team decided to do our final project on Oracle Cerner National EHR System. Oracle is the third largest technology company in the world. Its latest endeavor was the acquisition of Cerner. Together, Oracle Cerner announced its plan to create a national electronic health record database, also known as EHR. Their goal is to eliminate data fragmentation that is current in today's EHR structure. Their goal is to provide a centralized system to improve communication for patients, healthcare workers, and administration. Oracle is not the first company to attempt in creating a centralized EHR system. However, Oracle may be one of the best equipped to handle such a project. Oracle's mission statement states, "Our mission is to help people see data in new ways, discover insight, unlock endless possibilities." This goes hand in hand with some of the drivers for Oracle Cerner, which include improving patient and healthcare workers' daily lives, company growth for Oracle, huge profit for all who is involved, and continued advancement in technology. Challenges that may be faced are the overlay of technology and communication through different systems, supporting extreme amount of data, security and privacy for all patients and hospitals, and integration and logistics of the system. Some unforeseen pitfalls that could possibly occur are competition, slow growth speed, and insufficient capital for such a large undertaking. A rough scope that would need to be accomplished by Oracle Cerner to make this project successful is fully understanding the system and figuring out what works and why certain things failed in the past. It will be critical to have a fully invested stakeholder group that has the same drive to see this project through. It'll be vital to create a timeline and to make sure deadlines are met to avoid any pitfalls. After a system is compiled, and an extensive testing phase will need to be taking place to eliminate any issues with the system. With a fully functional system, it will then be ready to launch. A brief overview of how the data is processed will be in 3 segments. The first is the data source, where all the data is collected. Next, it'll be moved into a modern data platform where it'll be analyzed and stored. And next will be the experience of how the data is communicated to either patient, healthcare workers, or administrative support. Next, Zoey will discuss the theory and background.
For the next few slides, I'm going to share with you some theory and background of the EHR. History of EHR. EHR was implemented for the first time in the 1960s by Rochester Mayo Clinic in Minnesota. At that time, only government hospitals used it for billing and scheduling purpose due to its high cost. Also in the 1960s, the new approach called problem-oriented medical records added more vital patients' information. Although it was still on paper at that time, it was the foundations for the development of the EHR system today. In the 1980s, electronic records with fillable clinical information was available and become more popular and affordable for the hospitals and the clinic. In 2004, President George Washington Bush created the Office of the National Coordinator for Health Information Technology. The goal of this office was to maintain most American electronic health records within the next 10 years. Over time, with the advance in technology, 9 in 10 office-based physicians has adopted an MHR system as of 2017. For this one, I'm going to share with you some tech company that have failed in healthcare. For instance, we have Microsoft Health Vault, a web-based personal health record system. It was started in 2007 and shut down in 2019 due to lack of integration with popular wearable and smart health devices. A second reason for the shutdown was due to the limited social and sharing capabilities. Another example is the very big company, Google. Google Health was launched in 2008 and shut down in 2012. It was launched again in 2018 and shut down in 3 years in 2021. The reason of the shutdown in 2021 were due to the lack of collaborations between healthcare service companies. Some literature reviews. So EHR contains patients' medical history, such as demographics, prognosis, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. EHR system can include many different functionalities. However, in fact, they should contain three following main functions for better quality of care and lower cost at the healthcare system level. They are clinical decision support tool, computerized physical order entry systems, and finally, health information exchange. So on this slide, you can see the table on the left here. These are some common data types of the EHR that can be integrated or interfaced with internal or external registry. For example, you can see some BMI, which is body mass index. You can also see some health risk assessment, HRA, or patient health questionnaire, PHQ. So you can find lots of information here with the EHR system. So I'm going to pass it to Rob to share with you some of our research questions. Thank you.
Hello, my name is Robert, and I'll be speaking on the research question and strategy, as well as the hypothesis and data collection and analysis our team has come up with. To begin, throughout our analysis, we'll be analyzing the following research question on the slide, which is, does a National Electronic Health Record, or EHR, database help eliminate EHR data fragmentation in the medical field? To start, there are a few areas that need to be addressed when trying to create a single database that will house all data information. Topics such as data quality, data access or privacy, and EHR deployment are all key factors to consider while completing this project. These topics will be discussed in more detail in a later slide. Now, speaking in terms of our research strategy. As you will see over on the right-hand side of the slide, there are over 5,000 hospitals currently in the continental United States, according to the American Hospital Association. And this number has also increased since this model was created back in 2017. As previously mentioned, our project is based behind the idea of Oracle with the recent transaction or the recent acquisition of Cerner to finally create a well-executed and efficient nationwide EHR database. Additionally, other technology companies such as Microsoft and Google have previously dabbled in the health industry, but unfortunately learned it is a very complex industry that is not easily solvable. What we'll be trying to solve, or what our hypothesis is if each hospital were to implement a nationwide EHR system, one provided and created by Oracle with the input from various medical professionals, then this would provide an astronomical benefit in quality care, cost reduction, and data collection speed. Additionally, we are hoping that with the acquisition and utilization of past companies' experiences, we will be able to solve this critical issue. Before I go on to the next slide, I would like to note that we will be trying to quantify the impact of a nationwide EHR system and provide analytics and support, or analytics that support clear, actionable deliverables. Speaking now of how we collected our data set for this model, we utilized the American Hospital Directory website and pulled the current number of hospitals in the continental United States, including Washington, D.C., and created a Power BI chart or charts to help explain our findings. As you'll see here, out of the 5,000 plus hospital dataset, we focused solely on the top 10 states with the highest number of hospitals within them. Texas, California, and Florida lead with the most by state. Also to note, you will see in the chart to the left that there is a three-way tie for 10, which is Alabama, Oklahoma, and Virginia, all tied at 90 hospitals. Utilizing this data set and moving on to the data analysis slide, the top 10 states combined for just short of 2,200 hospitals. According to a report conducted by the Healthcare IT News, the average hospital utilizes an average of 16 EHR systems. Using this average along with the total hospitals from the top 10 states, that would combine for over 35,000 EHR systems being used just across this data set. To see the impact and importance of a nationwide EHR system over the same amount of hospitals, however, now only using one EHR system would mean that there would be a reduction of almost 94% of total EHR systems used over this data set. This is a huge and extremely impactful change, and will lead to substantial decreases in costs for both hospitals and consumers, but more importantly, help revolutionize how all individuals interact with the medical system. Thank you, and I will now be passing it over to Jeannette.
Hello, everyone. My name is Jeannette, and I will be talking about our paper's finding and implications. So with the hypothesis that we have, some of the findings and implications that we analyzed are quality care, cost reduction, and data collection speed. So we believe that the EHR database will, in fact, help eliminate EHR data fragmentation in the medical field. So below are a few ways that we quantitatively analyzed how Oracle Cerner will find business success in creating this database. And from the results, they will get these three findings and implications we came up with. So the first one is quality care. So we believe that quality care will in fact come into play, especially because a medical error is a common leading cause of most injuries or death in hospitals. So most medical mistakes are caused by data systems or process failures. So this implementation would help motivate hospitals to focus on immediate improvement for their safety and quality care of patients. Over the past few decades, we've seen a lot of knowledge significantly increase in the medical field. And now there's more treatments, there's more options available for patients. So people are also living longer and dealing with chronic conditions. So having a system can help improve the quality care by holding all of that new data for hospitals across the nation. There is also a cost reduction in doing this. So hospitals will find that some of the savings would include reduced transcript costs, reduced chart pool, storage refilling costs, and improved documentation and automated coding capabilities. So there would be a lot more organization, a lot more time saved as well, being able to store all this new data into one place, and for one place that all hospitals can find it at. In 2016, the Nationwide Children's Hospital actually tested a EHR health system called Learn from Every Patient program. And when they tested the system out, they actually saved $1.36 million in costs because it created fewer emergency room visits, it created fewer urgent care visits, and it only costed them about $225,000. So they did earn, and it was cost effective when they developed it. So we believe that this could be the same cost for Oracle Cerner as well. There is also a data collection speed. So with this one, the medical practice management can be improved through integrated scheduling systems, linking appointments, managing claims, automated coding. And this will help speed up the process for patients, the process for employees, and all healthcare professionals. Oracle Cerner would enhance the communication barrier between other clinics, labs, and hospitals with easy access to put patient information anywhere and anytime. On this slide, I did want to highlight the quality care part. So this was just a chart that we feel would help show the progress of how this would work. So it does start with a translational research. And so with this research, new knowledge drives incremental improvements in cost effectiveness. It moves into quality improvement, where the systematic application of improvements to care for all patients, and then patients receive evidence-based standardized care. So here's where we can visually see how the learn from every patient program model was a success.
In conclusion, Oracle Cerner's latest endeavor is to implement a national EHR system to eliminate data fragmentation in the medical field. Our research question was, will a national EHR database eliminate data fragmentation? Our hypothesis is yes. In our findings, it will improve quality of care, cost reduction, and data collection speed. How? The EHR system will store information for healthcare workers and patients to access on demand. It will increase quality efficiencies and cost savings and enhance the communication barrier between clinics, labs, and hospitals with easy access to patient information. And that will conclude our presentation today. Thank you.